Hi, my name is Angel Rivero, and joining me today is Dr. Regina Tan-Espiritu, who is the president of the Philippine Society of Reproductive Medicine. Thank you for joining us, Doc.
Thank you.
Doc, we have so many questions about reproductive health, about fertility. First of all, when does one know na it's time na to seek medical help about fertility? I mean, you can say na, no, I haven't tried long enough or I'm not doing it properly. But where do you draw the line?
Ideally, you allow the couple to have contact, regular contact, at least for a year. So if after a year they haven't conceived yet, then maybe it's time for them to consult. But sometimes it's not a hard and fast rule, and sometimes you make exceptions, no? Like if the couple medyo may edad na,
Yes.
if the woman is past 35, maybe I wouldn't wait for 1 year. Or if I know she has other pathologies that may cause infertility, I wouldn't ask them to wait for 1 year. Sometimes 6 months or 3 months. Kung may outright pathology, then maybe it's worth checking it out already. But kung wala, let's say wala silang alam, walang symptoms, we usually, if after a year of not being able to conceive, they should go for consult already.
I see. So, since it's very crucial for a woman to be ovulating, for them to strike that window, how can a woman tell if she's ovulating at all?
More or less, if you're having menses each month, then most likely you're ovulating.
Okay.
But if you really want to make sure, then there are some tests that you can do at home, like ovulation kit. Or your doctor can check on you, like monthly, they can do an ultrasound and check if you're ovulating, or do a follicle monitoring, especially when you're undergoing treatment. Or for some women, we can do more invasive tests, like endometrial biopsy, to check for progesterone levels. But usually, you just do a complete history, and more or less the doctor can discern already.
I see. Now, since infertility is not always just a female problem, but also maybe a male, then what tests can be done to the couple so that they can figure out things?
That's actually a good point, no? Because some of the couples usually think, it's always yung babae yung may problema. But actually, 50% of the time, the husband is also with a fertility problem, also has a fertility problem. And one quick way to test it, simply do a semen analysis.
I see. Is it something quick and straightforward? Do they need reseta for that?
Yes, I would suggest that the doctor request for the test to be done. And it's not quick in the sense that because the husband has to collect and the specimen has to be submitted to the lab. So usually it takes the lab 2 hours to analyze, and then after 2 hours you find the results.
That's right. So therefore, the couple must seek medical help together.
Yes.
And then get the tests that have been recommended to them.
That's a good point, no? We suggest couples seek medical help together. Hindi pwedeng, siya lang po ang papatingin, siya lang may problema. Or si husband lang po may problema. So,
that's right.
it takes two
That's right.
to conceive. So, dapat, as a couple, sila yung pasyente namin. It's not just the wife or the husband, but the couple as a unit.
Okay. Now, the different steps, syempre, we have siguro a more conservative way of addressing the problem. Can you briefly run us through those? Like from the pinaka-start all the way to nothing has been working, and then this is our final attempt to try to make this work.
If you want to diagnose, no, basic lang. Usually, what we ask for, at least for the woman's side, kasi there are many causes for infertility, especially for the woman's side. No? Pwedeng anatomic, pwedeng may tubal factor siya. Halimbawa, barado yung fallopian tubes. So, pag ganun, the egg and sperm cannot meet. So, you have to test that. Pwede rin ovulation problem. So, a simple test that we do, pag pupunta yung couple sa akin, at least do a semen analysis to test the husband, and do a hysterogram to test for tubal patency. Now, if the woman's more than 35 years old, then we request for a test for ovarian reserve as well. So that's a blood
reserve.
test.
Oh, it's blood.
Yes.
I thought they really take a look at your ovaries.
We do an ultrasound. So
Okay.
we get an idea also from the ultrasound kung how many follicles yung nagde-develop. And at a certain time of the month, if you do the ultrasound, then you also have an idea if she's ovulating. So that's part also of the workup. But ang pinaka-basic, at least we ask for semen analysis and we test for the patency of the fallopian tubes and other hormonal tests as we see fit. If it's necessary to do further tests, we do it as well.
I see. Is it true, Doc, na if you have a history of mga STD, you may actually become baog from that?
Yes, unfortunately, no? So maybe you're asymptomatic, but then we find out a few years later when you try to get pregnant, hindi ka mabuntis. And that was because you had a history of STD or pelvic inflammatory disease, and that caused blockage in the tubes.
Oh.
So when that happens, malaking chance, but talagang there's infertility for that couple.
I see. So sometimes it's irreversible na.
Yes, unfortunately.
Oh, I see.
So either the couple will go for surgery, and we try to repair the fallopian tubes, or they go for IVF if irreparable na yung tubes.
I see. It sounds very complex. Now, Doc, let's talk about some of the myths that Filipinos have when it comes to reproduction and fertility. Number one, does the position that they take during intercourse affect the fertility or the gender of the baby?
Hindi ka niniwala dyan. Although, well, hindi.
Hindi, no? Hindi. Okay, busted.
Gusto niyo discuss ko na yun. Sabi nila yung
Pwede
dog
naman.
style daw. Baka mas for male, but I really don't think there's a scientific evidence for that.
Even the site of implantation is not affected by the sexual position.
Hindi rin. Siguro kahit gawin niya nakabaliktad, hindi na yung sabihin na mas mababa yung implantation ng uterus.
Okay. Totoo po ba, Doc, na after intercourse, dapat nakahiga ng matagal yung babae para as much as possible, the sperms can swim through?
The sperms, by nature, are motile. So on their own, basta na-deposit na sila inside, kaya naman lumakad ng
Kahit
sperms.
against gravity?
Yes, oo. Kaya lang minsan nga, to aid siguro, we ask them, sige, higa ka muna for a few minutes in order to allow the sperm na hindi lahat, kasi pag tumayo siya, di syempre yung fluid, bababa.
Yes.
So, baka hindi niya malabanan yung pagbaba ng fluid. So, we aid, we ask them at least more, siguro 30 minutes. Actually, we do this especially for cases where we do insemination.
Oh, I see.
So, in that same way, in the same essence, siguro, then after contact, maybe it helps na for them to lie down for a bit.
To assist.
Pero usually, kasi yung iba sasabihin, Doc, nung tumayo ako, may lumabas na. Baka na sumama yung sperm doon. Not necessarily. Usually, yun yung fluid lang where the sperm was. Parang yun yung kung saan na-deposit yung sperm. So, after some time na nakakit na yung sperm, yung lalabas na fluid sa'yo,
Wala na sila doon.
dapat wala.
Hindi ko alam yun.
Unless siguro, ugod-ugod na yung sperm at hindi na maka-swim up.
Good. Paano naman, Doc, yung mga aphrodisiac? Kunyari, kumain daw ng maraming mga oysters para maging successful. May ganun ba?
Siguro, ang importante kasi, nakakapag-contact sila.
Okay.
And if the aphrodisiac helps them have contact na mas regular, then maybe in that sense, it helps. Dapat kasi mas yung contact nyo at least 3 times a week.
I see.
So, hindi big sabihin yung aphrodisiac talaga yung nakatulong. Pero maybe the idea na nag-aphrodisiac siya, mas may energy siya to have intercourse
Oo nga.
in a more regular pattern.
Right. Does it make sense when people say na they identify the window when they are fertile and then dun sila 3 times a week or every day and then the rest of the month hindi? Or is it better na hindi, sporadic para you kind of check all your bases?
Ito yung tinatry ko sabihin sa patients, no? It might help to know more or less when you ovulate. But you can't predict it. Even in the woman who's regularly ovulating, it can be earlier for one day, like this month, na paaga. The other month, mas malilate ng a few days, no? Importante for me, mas regular yung contact nila. Why? Because once na nag-ovulate siya, the egg has to be fertilized within 24 hours.
It's so fast.
Exactly. If you miss that window, tay ka na naman isang buwan. Tay ka na isa. So, unlike yung sperm, once na-deposit sila, they can stay there for at least 2 to 3 days dun sa fallopian tubes where they wait for the egg to come and be fertilized, no? So, if you're having contact at least every other day, knowing that the sperm will survive, enough na yun na any day of the week na mag-ovulate yung patient, may sperm na kaabang.
Oo
Okay?
nga.
So, I don't know if some doctors will disagree with me kasi they say, oh, you wait for this window. Eh, what if dun sa window na yun, you missed it for a few days? Kasi yun yung tansya mo. So, yung ibang couples kasi ganun eh. When I give them fertility pills, sila, ay, doc, ultrasound ako sa Friday. So, sa Friday kayo magko-contact. And sometimes, kahit i-ultrasound mo sila, what if nag-ovulate sila ng Monday? You missed that window already. Okay? So, this is a practical approach I tell my patients. Huwag mo na hulaan kung kailan ka mag-ovulate. Paghandaan mo na lang na you have contact every other day, regardless of whether you know you're fertile or not. Para anytime ka mag-ovulate, may nakaabang.
Tama.
So, I'm not sure if other doctors will agree with me on this, but it's for free.
Yeah.
So, wala ka ng test na kailangan gawin.
Libre naman, guys.
Yun lang, no? Minsan nagtataka ko, bakit may husbands na tumatanggi?
Talaga?
Parang, sabi niya, Doc, 3 times a week. Pagod ako niyan.
Ganon?
So, pero pag sinabi ko sa kanila, compare din sa treatments natin, ito libre. Piliin mo na yan. So, kahit pa paano, it might help. No? Even if I treat them, na I ask them to come for follicle monitoring on a certain date, knowing na alam ko mag-ovulate at that certain time, I still, parang feeling ko, back up pa rin yun if they have contact regularly. Kasi some patients, malas eh, when they, pag dumating for follicle monitoring, pumutok na pala yung follicle. So, sayang.
Sayang nga. On average, Doc, how long does the sperm stay alive?
So, yun, as I mentioned, around 2 to 3 days, kaya niya mabuhay dun sa...
Okay. Wala naman pong parang dying sperm tapos uugod-ugod tapos
pwede siguro, pwede hindi na siya umabot. Goodbye. Ganun eh. Hindi. Pero most likely, yung mga poorly motile sperms won't be able to penetrate the egg.
Oh, okay.
So she won't get pregnant.
Ngayon, Doc, to encourage fertility, therefore exercise, diet, tama ba yun?
It's so generic for us, but now I'm really looking into lifestyle affecting our fertility. So nowadays, you see more and more women na infertile, or more and more women, let's say, with polycystic ovary syndrome that contributes to infertility, or with endometriosis that contributes to infertility. Naisip mo, bakit ganun? Mas madami na sila, mas matindi na yung sakit, or dumarating na kahit mas bata. And I have reason to think the environment and the lifestyle that we have contributes. So in a sense, yes, no, exercise, proper diet would help. Because, for instance, if you have a poor diet, let's say high-fat diet, diet high in junk food, processed food, that tends to cause inflammation within the body. And inflammation has been recognized to cause damage to the egg and sperm as well. Maybe through when you have endometriosis or polycystic ovaries, a poor lifestyle will worsen these diseases, which in turn will lessen your chances of getting pregnant.
Right. What about puyat, Doc? Is that also bad?
I guess so, kasi na-affect din yung immune system mo. But technically, no, when ang dami natin nakikita na puyat eh, na stress, nagbubuntis eh. So, when patients ask me, does stress cause infertility, I put it back to them eh. I think it's actually the infertility that causes stress. So, tingnan mo isipin mo, Dok, ano bang pwede kong kainin? Or bang, tingnan mo sa payatas.
Oo nga.
Walang makain.
Ang dami nila.
Walang matiran, nagbubuntis. Ano yung secret nila? They have
Guys.
contact 3 times a week. Okay?
Wala silang ginagawa.
So yung wisdom. So I think it's more of parang I tell my patients, not to worry too much about stress, the stress factor. Because life should go on. You don't put your life on hold. Doc, na ako magtatrabaho para lang magpa-work up. No? Just go on with your life. Pero make sure na you try to have mas often yung contact to increase the chances. And maybe, yes, siguro, if you're more stressed, in a way, the couples, parang mas wala silang gana to have intercourse. Kaya siguro maaring in a way that lessens your chance.
Right, like
Pero I really don't blame stress as a whole as a main factor.
That's a very refreshing outlook at it.
Ewan ko, baka iba lang yung outlook sa ibang doctors.
Pero naisip ko rin, Doc, yan sa alcohol. Diba, supposedly alcohol is not really there to promote fertility. And yet, yung mga nalalasing, diba, the next day, buntis. Diba? So parang, it's part of the ironies. Ngayon, Doc, for couples who have tried all this and have still been unsuccessful in getting pregnant, what are your recommendations to them? So, see a doctor, get your tests, and then parang move slowly upward doon sa approach.
Oo. Actually, parang hindi naman siya dekahon, no? But it helps na magpatingin ka nga sa, I would suggest a fertility doctor para we go straight to the point and identify what areas we can help in, no? So, hindi naman pwedeng yung babae lang, iti-treat mo or yung lalaki lang. If both need help, pareho mo silang aangat. Pareho natin optimize yung treatments nila. So, what can we do? So, once we've identified through that diagnostic test if there's a problem, so we treat those. And usually, for infertility couples, we give them, we ask them to undergo ovulation induction. So, it's a process of giving them fertility pills.
Okay.
Now, let's say, na-test ko na yung pasyente ko, okay naman yung sperm count ng husband, patent naman yung fallopian tubes, then warranted na mabigyan ko siya ng fertility pills to help her ovulate. Or sometimes, if she's ovulating, help her super ovulate.
Super ovulate.
So, at least sana kung 2 or more follicles yung makukuha natin, mas malaki ang chance na may ma-fertilize. And then, ano pa yung process to? So, minomonitor natin yon. We have to make sure na she's yung gamot na yon, kung ano yung effect sa kanya, is she ovulating with that drug? And if let's say, the couple also has a male factor problem, hindi mababa yung semen count or yung concentration.
May drugs din para doon?
Well, there are, but some conflicting evidence eh.
Okay.
Merong nagsasabi na when you give fertility pills to the husband as well, nag-improve yung sperm count. Meron naman sabi, it improves the sperm count but not necessarily improve the pregnancy rate. So what we usually do when there's a male factor problem, we suggest insemination.
Oh, okay.
So intrauterine insemination.
Not necessarily na magparami ng sperm.
Di mo actually talaga maparaming sperm eh. Pero what we do with intrauterine insemination, you get the sperm, process it in such a way na nako-compress siya into smaller amount. So, tumataas yung sperm concentration. Maybe
so, mas dense na siya.
Yes, oo. And nasasala. Nasasala yung mga mababagal na sperm, nakukuha yung mga magaganda. So, nag-i-improve yung tinatawag na motility niya. So, after that, na-improve na yun, ini-inseminate na natin dun sa wife. Hopefully, it helps, no? But the success rate may not be as high as we expect. But it's a level-up approach compared to kung nag-contact lang sila or no treatment at all.
There is another old wives' tale that I've heard, Doc, which is that kapag malapot daw yung sperm, ibig sabihin, yun yung dense na dense. And kapag malabnaw, then ay siguro konti lang yan. Is there any scientific basis to that?
Hindi ako naniwala dyan.
Okay, so it doesn't matter. Okay, going naman, Doc, doon sa medicines that you can drink to induce the ovulation. Meron po ba siyang side effects? Like, will it make me gain weight? Will I get mga skin blemishes, pimples?
It can more or less means it's an individual approach eh. No, most of the time patients naman don't complain, but a few would complain na tumaba po ako dyan, or nagka-pimple ako, or nag-lose ako ng hair, or bad mood ako dyan.
Ay, may ganon.
Pero very rare ko lang sila naita, especially for mga patients taking yung clomiphene citrate. So,
I see. In your experience, Doc, have you had many patients beyond 35, like 40, 45, who have successfully conceived and given birth, or parang medyo 50-50 na at this point?
Dumadami na kasing nagpapatingin. And usually, yung mga nagpapatingin, past 35 na sila. So, sila na yung nagpapa-work up. No? So, now, dumadami rin yung percentage na nagbubuntis because they make the effort na magpatingin. So, we have patients na 42, 45. Actually, we know of a colleague of ours who got pregnant spontaneously at 50. Pero mas rare yun, mas rare yun.
Wow.
Pero for those na nag-undergo ng workup, past 40, dumadami na rin.
Wow.
Yung mga nagbubuntis.
So it's promising, parang at least.
Hopefully. Hopefully we're doing something
exactly
good for these patients. But, syempre, as always, we don't guarantee results.
Of course.
But it's worth trying for them.
is this something that you can also inherit from your parents? That if your mother gave birth a lot of times and very easily, the likelihood of you getting this experience is also higher?
Most likely kasi, kung may endometriosis ka na cause ng infertility mo, and, or yung mom, no? It's not, hindi exactly yung, parang fertile si mommy kaya fertile din ako. Hindi eh. Or infertile siya kaya mas infertile. Hindi. It's more of, nagkataon, let's say your mom had endometriosis and that caused that caused infertility. Most likely, you have the endometriosis as well. And that caused the infertility. Like, endometriosis can have a genetic tendency, or hereditary siya eh. So, if you have a first-degree relative with endometriosis, 7%, you have a 7% chance of getting that as well. And that can cause your infertility.
I see. Does factors such as blood type affect the compatibility of a man and a woman, do you think?
Medyo controversial yan, no? So, not necessary. For me, I don't necessarily believe na yung blood type will cause the infertility. But it might cause some difficulty in the pregnancy itself.
Oh, I see. What about interracial marriages? Is there some extra challenge with that if you're not both Asian or you're not both Caucasian?
Siguro kung physiologically, wala akong nakikita. But maybe in terms of attitude and beliefs. So, syempre kung different yung beliefs nila, mahirapan sila magpatingin. Kasi like the woman, usually na siya nagpapatingin, ayaw ng husband. So that will cause difficulty in that sense.
I see. And last talk is, what is your message sa mga nanonood who are considering to seek medical help but are nahihiya or parang, oh my God, this is so embarrassing because maybe I'm baog?
Ang gusto ko lang masabi sa couples, no, wag po kayong mahiya kasi we are here to help. And ngayon, actually sa Filipinos, noon ayaw magpatingin ng husbands eh. But now, I'm glad na they're coming to the doctors na, seeking help. So the earlier we are able to help you, then the more yung chances nila of getting pregnant. So, and sinasabi ko rin po sa patients ko, don't give up.
Yes.
Kasi it takes time. Even if we do the insemination or we do IVF, hindi yan 100%. So it depends on the outlook of the couple. Pag sinabi lang, ay Doc, hindi 100%, ayoko na.
Oo, wala namang
Pero,
gano'n.
don't think that way kasi later on, pag tumanda na sila, magsisisi din sila eh. So, minsan ngayon, nung 35, sinabi ko, you might need IVF. Ayoko, Doc, kasi baka less than 100% yung chance ko. Nung 45 siya, nagsisisi na siya na she didn't take it. Tapos sinabi ko, mas maliit na ng chance. Sabi niya, Doc, kahit na anong chance kukunin ko. So, what I want my patients to know is that if you need help, seek help early. Para mas maganda yung chance, no? It's just like business eh. If you invest in something, gusto mo mag-invest ka sa time na mataas yung return of investment mo. So, patingin na kayo habang mas may chance.
Ang ganda!
And don't give up.
Tama.
Okay lang umiyak, wag lang mag-give up. Kasi like for instance, I had this couple, nag-fail na siya ng IVF at 42, but at 44, she got pregnant on her own.
Wow.
So, minsan di ko rin masabi, no? Sometimes, kahit na well-studied itong field natin, arami pa rin namin hindi masagot. In the end, it's God pa rin. So, I think, for me, basta kung nag-fail ka ngayon, just keep trying. And eventually, siguro, with God's help, you get the results.
Last question pala, Doc, is if nanganak na kayo before, does it mean na it's easier to conceive or easier to give birth at least dun sa pangalawa, pangatlo, pang-apat?
Ako nanganak ka na before, let's say, nag-normal delivery ka.
Pero malaki yung gap.
Okay pa rin. Kasi,
Na-prove na.
Yeah, oo. Pero, you might be also, another side of that question is, kung nanganak ka na before, mas madali ba magbuntis ka next time for you to conceive, no? In a way, yes. Kasi kung nagbuntis ka na before, then most likely, pwede ka magbuntis the next time. But there are also couples na we term as secondary infertility. Uy. So, hindi ibig sabihin na nagbuntis ka nun, madali na each time. No? Tandaan mo, tumanda ka na. So, or kung meron ka may endometriosis to, nung nagbuntis ka, ba nga, mas worse siya. So, usually may mga couples na nakikita kami na nagbuntis noon, but the third time around, mas hirap sila. Hindi sila makakonceive. So, yun yung tinatawag nating secondary infertility patients. Meaning, couples na na-conceive na before, but next time they attempt, hirap na sila.
So, hindi nila dapat isipin na, nanganak na ako eh. So, hindi ko kailangan ng medical
Or
help.
wag ka nagpaligoy-ligoy. Kung plano mo talaga mag-anak, planuhin mo na. Hindi yung parang ko, hindi na. Kahit after 5 years, mas madali for me. It's not necessarily the same.
I see. Alright, Astig. Maraming salamat, Doc.
Okay, thank you.